So we're gonna do a vampire facial in combination with Mezotix, with a Tixel Mezotix. So it's quite an interesting treatment because we're going to use the ability of the Tixel to make the skin more permeable through the conduction pathways of the skin that will allow the PRP, the vampire PRP, to pass through the skin and have a very profound regenerative effect. So in effect, we're using the Mezotix to work like a needle. So instead of having to use a needle to inject the PRP, as we normally do with a vampire facial, we're going to allow the skin to absorb the PRP through little channels that are created during the Mezotix procedure. We know that the skin becomes porous in that way and allows things to pass through for up to 6 hours afterwards. So it's going to be a very nice way of doing a vampire facial treatment, but in combination with the rejuvenative effects of the heat effect of Tixel. So we're just going to put the blood into the Magellan system. This is the system we use for all vampire treatments. It's the Magellan True PRP. It allows a large amount of blood, in this case 60 mils of blood, to be used, which is then going to be processed through the Magellan system and the cell separation with centrifuge. It is the best piece of equipment on the market at the moment for producing a very high concentration, a guaranteed high concentration of PRP. And that's what makes the vampire treatments, the O shot and P shot, very effective PRP treatments. And you just overlap a little tiny bit. You've got to remember where you've gone. And so we'll do a section like that.
Yeah.
And then I come back.
Over the same?
Not just slightly overlapping.
Okay.
And then I move over. And then when you're doing this eye bit, you've got to stretch the skin. And then I'm going to do above the brow, so I'm lifting the brow out the way. So we've now done the Mezotix, the Tixel Mezotix, over the whole face and neck. So the patient's quite nice and red, which will settle very quickly, as you'll see. But I've now got my 5 mils of very highly concentrated PRP, and I'm just going to start applying that. I'm just putting that over the surface of the skin. As I said, the skin is at this point very, very porous. So these are all these platelet cell growth factors are going to be going in beautifully. Can be a bit stingy. PRP is mildly inflammatory and can feel a little bit stingy. Okay, so we're just applying a nice thin layer over all of our treated areas. There's no way we can react to this because these are our own cells. The platelet cells are cells that are there to help the body repair. So if we cut ourselves, burn ourselves or whatever, blood goes to that area. Platelet cells are in high concentration to part that healing process, and they will release the growth hormone, the growth factors, and there are 20 different repair growth factors in platelet cells. So we're really just harnessing the rejuvenative, the healing power of our body and the combination of the Tixel with PRP, with this vampire PRP, is to really get this skin to remodel. Our patients had a lot of sun exposure over the years, and that creates this changes to this what we call photo damage to the skin, photo damaged skin, and we can really get that skin to rejuvenate in a more youthful way and appear more youthful with this treatment. So I'm just making sure we've got lots of it on the skin. So this is a hyaluronic acid, peptide, growth factors, synthetic growth factors and peptides, and pure hyaluronic acid. And this mask is going to sit on the skin and help the PRP penetrate further. It's also quite cooling, so the patients find that it gives a nice feeling of relief from the heat that's generated from the Tixel treatment. Okay, and what we'll do is we'll pop a little bit of more PRP just under this mask and let that work in nicely. So we've got our patient nice and comfortable here. So how did you find the treatment?
Yeah, fine. Better than I expected. It wasn't too hot. Treatment areas with the numbing cream on wasn't painful at all.
Good. And afterwards, how did it feel before we put the mask on?
You could feel it heating up and my face and neck getting quite hot, so it was quite nice to have the cooling gel and mask put on afterwards.
Okay, so we're going to leave you for 15-20 minutes, let all that PRP, the growth factors, all the hyaluronic acid and all the other nutrients and things that we've got in the built into the mask, and we'll let that absorb into the skin.
Thank you.
So we're now finishing off our treatment with LED phototherapy. This is again a new treatment, but it's been shown that LED, or light emitting diodes, which is a very low level light laser effectively, has in itself powers to stimulate and regenerate healing, and it consists of 3 different LED lights. Red light, which reduces inflammation and stimulates healing and repair. Blue light, which actually reduces the bacteria on the skin and prevents infection and helps with infection. And then near infrared light, which penetrates a little bit deeper. We can't see near infrared, but that will penetrate deeper, and it will again help the healing and regenerative process. I really like to use LED phototherapy when I've done a treatment such as Tixel or Fractura, or any treatment really where we've created a little degree of trauma to the skin to get a regenerative benefit. The LED will work synergistically with that treatment. So what we'll see now is that it will help reduce the redness post-treatment, and it will speed up the healing process and work with the treatment I've just done. I mean, LED phototherapy can be used in its own right, and we often use this treatment for acne, where there's active acne. It will keep the bacterial levels down and reduce the inflammation, so it can be an effective treatment on its own for acne. But it can be a very stimulative treatment just on its own for a nice rejuvenative treatment. There's absolutely no pain, no downtime, and LED is very safe. It doesn't have any UV in it, so there's no risk of exposing somebody to a skin cancer risk, and it has no damaging effects on the eyes either. So again, 20 minutes under the LED, and then we've finished our treatment today.